All right, so before coming into the patient's room, I would assess for any markers or flags at the door, noting any types of precautions such as fall precautions or contact or droplet precautions. I would come into the room, perform hand hygiene, introduce myself to the patient. Hi, I'm Molly. I'll be your student nurse today.
Hi.
Can I just see your name band real quick? All right, and could you tell me your name and date of birth for me?
Sarah Morris, 22494.
Okay, and do you know where you are today?
Johnston Willis Hospital.
All right, and today's date?
Friday, December 2nd.
And why are you here at Johnston Willis today?
My throat was really inflamed.
Okay. So on a scale of 1 to 10, with 1 being the least and 10 being the greatest, how would you rate your pain?
1, they're treating it very well.
Okay. So at this point, I would look around the room, assess for any sorts of environmental hazards, IV poles in the way, trash, etc. So the patient is lying in a supine position with a calm and relaxed facial expression. Their level of consciousness, they seem to be aware and alert to their surroundings. Their skin color is warm, skin color is appropriate for their race and ethnicity. And their speech and their hearing seem to be appropriate as well. No deficits are noted due to their response to my questions. And their personal hygiene is clean, neat, and appropriate as well for the season. So based on that, I would say that the patient is alert and oriented ×3, and their verbal responses were good. So I'm just going to go ahead and test your motor responses real quick. Can you grab these 2 fingers and squeeze? All right. Push against my hands. All right, and pull back, push against my hands. All right. And can you raise your arms above your head? Okay. And can you bring your knee to your chest for me? All right, and repeat on the other side. Awesome. All right, and so now I'm also going to check for your pupil sizes real quick. So if you don't mind, I'm just going to shine this light in your eye. All right, and the other side. Okay. I would say that the pupil size is about 3 millimeters, and they are equal and reactive to light, and they also are accommodating. There's no there's no ptosis noted, no facial drop, and I'm real quick just going to touch you down here. Feel that?
Mm-hmm.
Yeah?
Yep.
This?
Mm-hmm.
Okay. So their sensation seems to be appropriate in all of their extremities. Again, communication skills are appropriate, and real quick, just going to put my fingers here, and can you just swallow for me? Okay? And have you ever had any pain or trouble swallowing in the past?
No.
No problems noted. Okay? So at this time, I would assess any sorts of assistive oxygen. Patient is not on any, but if they were, I would check for the device being used and the flow rate. And again, their respiratory effort is unlabored, no accessory muscles are being used. And I'm just going to listen real quick to your lung sounds, if you don't mind sitting up for me. Okay, and I'm just going to move my stethoscope around on your back, so just every time I move or it hits your skin, just take a deep breath for me, okay? Okay, and I'm just going to repeat on the front, okay? So the lung sounds are clear bilaterally, no adventitious sounds are noted. Can you take a deep breath and cough for me? Okay, so it was a dry, non-productive cough. If it were productive, I would assess the color and amount of mucus that was produced. And if the patient had any issues taking a deep breath, I would then educate them on the use of an incentive spirometer. So next we would do our cardiovascular assessment. I'm just going to listen to your heart sounds real quick. Do you mind sitting back up for me? I'm sorry. Okay, so first I'm going to listen to the apex. Okay, and I'm going to assess the apical pulse and the radial pulse. No deficits are noted there. Then I'm going to listen to your valve sounds, if you don't mind. Starting at the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I would go ahead and then repeat that with the bell of the stethoscope. Can you just hold out your fingers for me? I'm just going to squeeze. Okay, so your capillary refill is at less than 2 seconds. And then I'm going to check for any sorts of edema in your lower extremities, which nothing is noted there. And then I would check for your tibial pulse and your pedal pulse, both of which are strong and bounding. And I would check for any sorts of IV fluids, if everything was working properly, and I would also check the IV site to check for any sorts of infection, and that everything was working properly. So again, skin color is appropriate for her race and ethnicity. Temperature, she is warm and dry to the touch, with no moisture noted. The patient is not at risk for any sorts of skin breakdown, but if they were, I would assess that for any sorts of ulcers or lesions. If the patient were to have any dressings, I would also assess that for any signs of infection, the drainage, and if they needed to be changed. And I would also, again, if the patient were at risk for skin breakdown, I would use the Braden scale to assess for that, or any potential ulcers. So her abdomen, I'm just going to lift up real quick for you. So her abdomen is flat, symmetrical on both sides, no contour, crazy contours noted there. I'm going to listen to your bowel sounds real quick. Okay, so we have active bowel sounds in all 4 quadrants, and I'm just going to lightly palpate around for you. Any pain or tenderness? Mm-hmm. Okay, so no tenderness or swelling is noted. Patient doesn't have any drains or tubes, but if they did, again, I would assess for any signs of infection, skin breakdown, etc. When was your last bowel movement? This morning. Okay, and do you normally have any issues voiding either bowel movement or urination? No? Okay, that tells me that this patient's diet, or they're tolerating their diet well, with a good nutritional status, and that they don't have any issues with voiding at all. So, but if they were to have any issues and they had a Foley catheter in, for instance, I would check the color, clarity, amount, and odor, if possible, of the urine. So, like I said, the patient is not on any bed rest, so the head of the bed is at like a 45-degree angle. They are not using any sorts of SCDs or TEDs or foot pumps, but if they were, I would make sure that all of that equipment was working properly and they had no signs of any DVT. The patient is active and independent, so they are in assist time 0. They're able to transfer to the chair without any assistance and don't use any sorts of ambulatory assisted devices. If there were to be a fall risk, I would assess that, make sure they have their yellow safety socks on, and that things were clear and free, and that everything was good for ambulation. So at this time, I would make sure that the bed is at the lowest position, the bed rails are up, and that the brakes are locked. I would make sure that their call bell is within reach, and then I would also, if needed, make sure that the bed alarm is set and active. And then at this time, I would tell the patient that I am going to go document and that I will be back and to call if they need anything. All right. Thank you so much. I'll appreciate it. I'll be right back for you.
Have a great time.